Okay, well thank you all so much for coming along to hear from myself and from Hiam and from, I totally forgot your name. Moses, that's right. It's really interesting to hear what other countries and other universities are doing, and I was really interested to hear that your president of your university is very supportive of your health promoting university model, and I'll talk about that a bit later on. But I'm Elly, I'm the Senior Project Officer for Healthy Sydney University. Please motion to me if you need me to speak a bit slower. I know the Australian accent can be a bit strange to people's ears. Sorry, the next slide, please. So this is just really what I'll be talking about today. I'll tell you a bit about some of the health challenges that are facing Australia at the moment, for those of you not from Australia, and about the University of Sydney, just some statistics that will give you a bit of a picture to why we've gone through the approach that we have. A bit about also the approach that we've developed, our core message and our guiding principles, and some information about some past projects and current projects and what we'll be working on for the near future. Next slide. So, look, I was trying to think of a funny way to introduce what it is that Australia is all about, and I found this through good old Google, and I thought it actually typified what a lot of people think that Australia is about. You know, all these dangerous animals, lots of sharks, even though the chance of getting a shark attack is, 1 in a billion chance or something. And then in the middle, there's kind of seen as bugger all. And I did want to point out first and foremost that we know this is not true for a number of reasons, but also because Australia has actually been inhabited continuously for almost 40,000 years or longer by Aboriginal and Torres Strait Islander people, our First Nation people. And I want to obviously acknowledge them and the struggles that they've faced, not just in terms of health, but also in terms of education, housing, employment, a whole range of things. And I do also want to pay tribute and acknowledge the people of the Okanagan Nation who have so generously allowed us to come and meet and learn and network on their land. And in Australia, we always, before we do presentations and official things, we acknowledge the traditional owners of the land because they have never actually ceded their sovereignty over the land. So, in terms of Australia, look, we are doing pretty well. We were in the news a lot after the GFC because we were one of the few countries to actually have an economy that grew. We've been doing really well in terms of low unemployment, although that's rising a bit now. We've got a high GDP. We're very highly educated. I actually found out the other day that almost 3 million people of our population have a bachelor level degree or equivalent or above. And the other thing about it is our higher education sector has a lot of students domestically, but also internationally. We have a huge number of international students who bring in a lot of money for our economy, and international higher education is actually our biggest export after iron, coal and gold. So, we're doing pretty well in terms of all these characteristics. However, we are facing really significant health challenges and costs, and I think you'd probably see this mirrored in a lot of other high-income countries, but as well, we know in low and middle-income countries, they're experiencing some of these issues as well. So, for example, in terms of poor physical health, we have about 65% of Australians are now overweight or obese, 18 years or over. Type 2 diabetes affects about 1 million Australians now. We've got high levels of stress and poor mental health, and all of this is really impacted further by an ageing population and workforce, which, like I said, is probably what a lot of you guys are experiencing as well. So one of the ways in which we were thinking about, how do you target and drive widespread behavioural change? And that is really through challenging the everyday settings in which we live and challenging the status quo of our systems. And also, obviously, looking outside the health sector for solutions. And look, as a social determinants of health person, I love Michael Marmot, and, I've read pretty much everything he's written, and he's given some great sort of core lines about how we need to actually challenge the material, the social, the political and cultural conditions that shape our lives. And only through doing that will we actually be responding to these great health challenges, which are so related to education, workplaces and employment, urban and town planning, housing, the agriculture and food system. It's incredibly complex. So the University of Sydney, this is probably one of our official photos that we like to focus on and say to all our students, come to our university, you get to work and study in here. But unfortunately, I think only a very small number of students actually study in that building. So it's a bit of a lie, but we're a very big university. Next slide. So we're just over 150 years old. We've got a lot of students, almost 53,000 students, a lot of staff as well. So really we're talking about 60,000 staff and students spread across metropolitan Sydney and a few regional campuses, 8 campuses in total, and 16 faculties, which I can tell you presents a lot of challenges. So we've got medicine, we've got arts and social sciences, science, agriculture, even music, fine arts, architecture, and they all have their own distinct faculties and their own special ways of doing things. And we also have 8 residential colleges. So this photo was actually taken at our orientation week this year, where we used that as an opportunity to talk to students about how they can stay healthy while at university, and we had some great responses from, we talked to thousands of students during that week. So our core message is about how we can support healthy people, build healthy places, and create healthy policies and practices. We launched in June 2012, and our focus is on bringing staff and students from across the university together to collaborate on projects and initiatives that will increase our overall wellness as a community and as a population. And that bit about the population is really important, because we're not about targeting individuals, but we want to actually change the environment and the settings as a university, and that way we can impact on our core business of teaching, learning and research. And we think that there's some really interesting opportunities that universities provide in this space. And obviously we also want to look at how do we actually support our students and staff to flourish in the work they do, what they're learning, what they're teaching and what they're researching. So it's really about utilising existing resources and finding champions who will promote in their own particular area health and health for all. And our guiding principles are these 5 here. The first one, which I've talked about, is that population-wide approach to the health of our community. So not the individual health behaviours, but actually how everyone as a community flourishes or sometimes flounders. University-wide engagement at all levels really means that we are about bottom-up and top-down work and approach. So getting support from your senior management of the university and senior academics, and then also working with staff and students to give them a voice to engage with Healthy Sydney University, if they're interested, of course. The third one is really important for us. As a research-intensive university, everything that we do has to be informed by and also generating evidence. We want to ensure that what we're doing is actually adding to the research body in a particular area, and that obviously what we do is also properly evaluated, so we know that it has impact and influence. And that is sometimes a challenge, because it does mean we have to match up academics in particular fields with professional staff and students to drive projects. The fourth one about collaboration, that we do want people to collaborate who are actually from disparate backgrounds and areas. That's one of the most fantastic things that I see is engaging students from architecture with an academic from the School of Public Health and the head of Human Resources to drive a particular initiative. And obviously the last one about a holistic view of health and well-being. And I put up this wellness wheel because I really like how it looks at the different components of wellness. And I think in a university, what we need to do is interrogate and analyse all of these different components that are making us well, or in some cases are actually hindering that approach to wellness. So how we're set up is there's me, and I pretty much run the show, and I report to the chair of Healthy Sydney University, who is a former dean of one of the faculties. And then we have some working groups that I support, and it's around these areas where we consulted with staff and students where they wanted to see the most action. And the most popular one at the moment is the Eat Better group, which is about improving the food environment. And so obviously we've got Move More, Sit Less, which is about physical activity, promoting physical activity and exercise. Mental wellbeing, which speaks for itself. And then our last working group is an interesting group because its task is actually to translate initiatives and projects that we have funded and we've piloted. And if they're successful, they work on how we can embed that across the whole university. So in a way, they've actually got probably the hardest job, because we want to make sure that the small kind of pilots that we trial, that then they become embedded in the everyday life and business of the university. This photo is taken from one of the food environment interventions we did at one of our other campuses, where we actually moved all of the healthier foods to the front, and we wanted to compare whether students bought more of these healthier foods because they were more visible, and previously these foods had been kind of hidden towards the back. Because we do know from the research that if healthier foods are easier to see and access, that there is actually an increased likelihood consumers will buy them. No coincidence that all the big food manufacturers pay premium for shelf spacing at eye level in supermarkets and so on. But unfortunately that's not the norm at our food outlets, and so one of the trials that we did with some nutrition and dietetics student and our student union was about kilojoule labelling on the menu of our student bar, which was a fantastic opportunity to actually influence the menu design and generate some research about point of purchase menu labelling, nutritional labelling in Australia, because most of the research is actually from a North American context. And it's helped by the fact that our state government in New South Wales, where the University of Sydney is, they've moved towards a point of purchase labelling for all fast food outlets that have a certain number of stores. So we approached the student union and asked them if they wanted to trial this, and the response was great, and we were able to influence their menu design and keep this ongoing. So for example, they reduced the size of their burgers, the size of their chips that they served, the type of buns used, the patties. It was actually a fantastic kind of project to generate some original research and evidence while also having a really positive impact on a place that is really heavily visited by students. And importantly, the educational campaign we ran alongside it showed us that actually there was a really high level of popularity for this kind of thing by students. So I think there was 1 or 2 students who said that they didn't like menu labelling at all, and that they wanted to see it gone. Everyone else was actually incredibly supportive of it, and that has given us, the results from that has given us a lot of, a big basis from which to say to the other university food outlets, could you consider something similar? Or, you know, the next step might be actually getting a high-level support to pass a policy where all food outlets on campus are required to have nutritional labelling. Here's another one, which was about stair use promotion signage, which, look, it was probably a bit controversial to begin with because the researchers had a bit of a hypothesis that the signage was going to do nothing to promote stair use, and they were actually right. What we did actually find, apart from that, was the most significant impact in terms of stair use in buildings is about the speed and access and availability of lifts and stairs. So you know, it would make sense to me, and as it would to you, that if you can't see the stairs, how do you know they're there and why would you use them? Similarly, if the elevator is very slow, why would you use it when it would be quicker just to go up one flight of stairs? So this actually gave us some really good information around how we target messaging and reminder tools about healthy behaviours. But it also says we have to be extremely careful about the building design, because it's actually the physical environment that is driving our behaviour and our choices. And we have to make sure that the healthier option is the easiest one for staff and students to choose. And I'll show another example of this on the next slide. This is actually the building I work in, which is a brand new research facility which is focused on finding answers to complex problems like obesity, cardiovascular disease and type 2 diabetes. And this building was actually built specifically to encourage incidental physical activity throughout the day. So you don't have trash cans under your desk, you have to get up and walk. People don't have their own photocopy machines, you actually have to walk to this common area. The toilets are actually quite a long distance away, so you're always getting, I mean, on a typical day I might do, you know, like 8,000 steps in this building alone or something, which is pretty good for my 10,000 step goal. But this building is also sort of shows the pitfalls of having really good intentions but actually not following through with them. And you'll see actually in this photo that there's actually these glass doors that block you from using the stairs. So the lift is actually really accessible for people to use, but unless you've got a special swipe card if you're a staff or student, you actually can't walk up and go around the building using the stairs. You have to use the lift. And I suggested, why don't we actually remove those and see if we can increase stair use? And I was told, no, then we have all kinds of people walking around the space and it's very unsafe for staff and students. And I've sort of said in response, well, we're a public institution, we should actually be open and inclusive and welcoming of people to come and look at a fantastic building. So yes, that kind of work I think needs a bit more work, and it also needs to happen really early on. So people like Healthy Sydney University need to be involved in the initial planning stages and then also following it through right to the end to make sure that the builders and architects and engineers are on board with what we want to do. Oh, okay. All right, I better whiz through these. All right, this was a mindfulness pilot that we did with staff. We're just finishing up the research now, which we're hoping to publish later this year. Basically, this was really about whether mindfulness is effective at reducing stress amongst employees in a university setting. The good news is yes, I think I'm allowed to say yes. We did find that the distress scores of the groups that we used fell by about 4 points, which apparently, according to the results, was significant, which is statistically significant, so yay for that. And we're interested now in how we see more mindfulness training and practice embedded within students and then also staff, like, for example, they have at some other universities. We also have done a physical activity and transport survey, which did bring up some really interesting stats around the fact that we have quite a low number of staff and students cycling to campus, and that's something we're going to be working on. We do have a high level of car use despite the location of our main campus near the biggest public transport hubs in Sydney. That's very interesting. And that also our student and staff populations are actually quite highly sedentary. So some of our current projects following on, next slide, is if we want people to be standing and moving more during the day, particularly students, how do we support a standing desk at the back of lecture theatres to allow students to stand up? I was actually really wanting something like that this morning because I had a bit of a sore back when we were in that session before, and I sort of crept up the back and all I wanted was a little desk to be writing notes and standing up, but that's all right. UBC can do a collaborative project with that on it if they want. Obviously, the food environment, I said, was a very popular and important area for a lot of students and staff. We've been doing a campus food survey, which actually found out that cost was not the number one priority for students. It's actually first taste and then convenience. So this notion that students aren't going to pay for healthier options, well, actually, if they taste good and they're right in front of them, then maybe they will. And some other areas in terms of policies and practice, our travel plan, which I sort of alluded to before, around improving cycling and public transport use to our campuses, our healthy catering guidelines, which is what we're working on at the moment, so that it's easy for staff to choose healthier options from our main catering companies, and that's been a great way to engage with the catering companies about improving their menu design, and the systematic review of improving mental wellbeing in universities, which I will be talking about in a separate presentation tomorrow. And I put this photo up there because I was asking myself and some of my colleagues, how do we actually know when we've achieved our goals of being a health promoting university? And our answer was when our principles are embedded across everything we do as a business and an institution. And I think it was Shelley Kayfish from UBC Human Resources who said something similar yesterday. And this is an example where in my building there was someone who was raising some money for the Nepal earthquake using the usual Australian charity box of chocolates where people buy chocolate and they leave the money in a donation. And a colleague who I still haven't worked out who it is actually bought a bowl of apples to put there and said, and was encouraging people to, maybe pick both or pick the apple and they could still donate some money. And I thought that was really, really impressive. We've got 5 minutes for questions. Okay. All right. And this is just a bit about what we'll be doing for the next 4 or 5 years as our university is going through a new strategic planning process, and we're really hoping that health and wellbeing is going to become embedded into all of the sort of strategic priorities of the university. Look, that's our major project, which people can talk to me more about because I could talk for hours about it. But then the very last one is, when we were talking before about having your president supportive of what you do, this is our vice-chancellor, our head honcho, and he loves bike riding. He's an avid cyclist, and he wrote this thing on our staff social media website about encouraging staff to compete in the Global Corporate Challenge and to, think about cycling. And I think it's fantastic that we have someone in a very clear position of leadership directing and influencing other staff to be engaged in what it means to be healthy and well. So yeah, and I also have...
Can we have that while you
yes,
answer questions?
yeah, sure. I've got our sort of annual report from 2013 and 14 and a postcard, so you can read a bit more about what we've done and what we're doing, and you can also get in touch with me. Thank you.
Are there any questions for Elly?
Oh, hello.
Thanks for a great presentation. One of our projects through our university is trying to change our vending machine options.
Oh, yes,
And
yeah.
one of our challenges that we've had is those vending machines earn the university money. So how have you gone about shifting that so we can change them?
Yes, that's always a challenge when there's dollars involved. Our vending machines are actually, the profits from that go to our student union, who pour it back into the student experience. And we've built a really great relationship with them about really sometimes slow and small changes, which to traditional public health people like me and my colleagues, we sort of go, oh, this is going to take forever, why can't you just do it? But we've realised now that their priority has to be the sustainability of their organisation and what it provides the students. And what we're actually doing with the vending machines is we are talking with the student union and the suppliers directly about healthier options that they're moving towards, because there is a big kind of push for some of these companies. They realise that actually some of the foods and drinks that they're selling are not healthy, and that consumers are cottoning on to the fact they're not good for them and that they'll actually buy less. So that's why we've seen I think it was Nestle, they've moved to smaller serving sizes, and Coke has just moved towards that as well in Australia. So I think it's about working with those guys and also playing a bit on their terms. We do also have another proposal which is going to be a bit controversial, which will take a few years to work on, and that's about actually getting rid of sugar sweetened beverages from our campuses, full stop, in the same way we've moved towards a smoke-free environment, and that will require some real kind of coalition building because of the loss of revenue that may accompany that. We've got to figure out other ways in which the student union can maintain that revenue so everyone's happy, or maybe everyone's equally unhappy, but yeah.
Thanks so much. That's wonderful.
Okay, great.
Thanks, Elly. Sorry to rush you.
No, that's okay. Whoop.
All right.
So while you're bringing that in, Emily, you said twice about
Okay, you put that up here.
Emily.
Do you want to sit here?
Elly, sorry,
and then-
you said twice about putting the multi-step forward, but you never said whether it was effective. So I got a sense
I got
maybe
some
not,
time
right?
cards that'll
It,
show you.
oh look, overall it was not hugely effective, but it was a very small kind of pilot in a small setting, and so I think we have to, we're doing a similar kind of thing, but actually involving pricing and more kind of promotional signage. So it'll be interesting to see whether actually that has more of an effect.
Yeah.
Ladies and gentlemen, we have a really short time, so I wrote my speech, and if you apologize to me, I read it quick and perfect way. But before, may I introduce my colleagues, see there, Ms. Katalin Cipan, who is the senior higher education expert, and the next, Mr. Gyula Gili, who is the senior higher education and health promoting expert. Okay, let's start. For me and for my colleagues, this is the first time to join your conference in the field of health promoting universities. I am an ongoing president of Hungarian Higher Education Founding Council, and in this position I have a great pleasure to participate in the preparation for establishing health promotion in Hungarian universities. For me, it's a really great chance because besides of my academic work, I'm responsible for the Hungarian University Sport as a Secretary General of Hungarian University Sport Federation. And I'm also involved in this subject personally as a 40-year-old amateur triathlonist who tries to live as healthy as possible on his own way. So you know better than I do that the quality of life mostly depends on lifestyle, healthy living and circumstances, not on the classical healthcare system, treatment, rehabilitation and prevention. In the case of the curve of quality of life, for example, if you get ill, you are dropped down from the curve. I try to right here. If you get ill, you drop down from the curve, and the treatment, if it's perfect, gets back to the same position to the curve. It means no more health quality, only repairing the problem. But with health promotion, you can rise the peak of the curve in this way, extend the time span of the high level curves and moderate the decline. So increase the health profit, that is the under area of the curve. You can see the differences here. So we consider health promotion in the framework of the World Health Organization. Firstly, the general concept of health, physical, mental and social well-being. Secondly, the health for all approach, and within it the settings-based methodology, and all these leads up healthy cities and health promoting universities. Besides the harmonization with sustainable development, the emphasis on the organizational development, the management issues, the holistic idea, the long-run thinking, and the bottom-up development process. Actually, in the Hungarian higher education institutions, there are very poor systems and services in field of health. Only some area involved, mostly those that deal with the risky groups of students, and there isn't enough positive health concept. You can see some current examples of the type of interventions we have found in Hungary. I must say there is no comprehensive policies, no systematic implementation and programs, just initiatives and pilot and ad hoc projects. And if you look at the service development plans of universities for the next 5 years from the nationwide research, the student life and sports have some new services or schemes, but this approach and teams are not emphasized. No any word about health promotion. In the second part of my presentation, one of the centrally important issues getting attention from the Hungarian government is sport, which is a really significant part of the health promotion in the age of student. The physical activity, the concept of sports for all, is not a luxury. It is a public issue, of course. In so much, according to the latest declaration of UN General Assembly, sport is essential for education, health, peace, and development. For a long time, we know the WHO evidence-based statements for the health benefit of regular physical activities, but less can be heard about UNESCO argumentations that sport is one of the basic human rights. Apply this to the case of university sport and agree with FISU that students are the leaders of tomorrow. In Hungary, we prepare the Alfred Howse plan to develop the higher education sport. This is the one piece of plan. Maybe you can see it. Our university sport program deals with the top athletes, helping them to not give up their studies. And on the other side, deals with all students, trying to motivate them to do sport besides education. But before we found our new sport development programs, we have to identify our target groups. We have to know our students' attitudes, habits, and possibilities. So we have conducted some nationwide research, and after a careful elaboration, found a starting position. On large-scale online inquiry and one representative survey give a valid and complete picture about how students think about their sport activities. The most important consequences is that 23% of students do sport enough. You don't see it in the bottom of the picture. But they are not our target, I'm sorry. The second group, who spend a certain time on sport activity but not enough, they are the addressable group of our interventions. Sadly, almost 29